You know those frequent trips to the bathroom? Especially the ones that wake you up at night? What if they're not just an inconvenience? What if they're actually a clue your body's trying to send you? Well, today, we're going to decode those clues together.
So, does it ever feel like a trip to the bathroom is, well, running your life? Like your entire day, or even worse, your night, is planned around where the nearest restroom is? If that sounds familiar, you are in exactly the right place. We're about to dive into why this might be happening.
And look, paying attention to this is so important. By the end of this explainer, you're not just going to know the why behind all those trips, you're going to have a clear plan of action. So think of these next few minutes as your first, most powerful step toward taking back control. First things first, if this is you, I want you to know you are so far from being alone. I mean, look at these numbers. At some point in their lives, about 40% of women and 30% of men deal with frequent urination. It's a super common issue.
All right, so where's the line between what's normal and what might be a little more concerning? Well, for most adults, going about 5 to 7 times a day is pretty standard. But if you're hitting 8 or more, that's a clue. And what about at night? You know, getting up once might be normal, but if you're under 70 and it's happening twice or more, that's another clue. And finally, let's talk volume. Anything over 3 liters a day is usually considered excessive.
But you know, it's not just about the numbers on a chart. This is the real takeaway, right here. The true warning sign is when it starts messing with your quality of life. Is it wrecking your sleep? Are you starting to turn down invitations or avoid social events? That's when your body is screaming at you that it's time to dig a little deeper.
Okay, let's start our investigation with what we'll call the usual suspects. These are the most common culprits, the ones that are often tied to our lifestyle and habits. Now, this is where it gets really interesting, because so many everyday things can be the cause. I mean, drinking too much fluid, especially right before bed. That's kind of the obvious one, right? But have you ever thought about diuretic drinks, like your morning coffee or that evening tea? Or even foods, like dark chocolate? Even stress and anxiety can make you feel like you have to go. And here's one a lot of people miss: constipation. It can actually put physical pressure on your bladder.
All right, so we've looked at this simple lifestyle stuff, but what if the clues are pointing to something more, something medical? Now we're going to follow the evidence and get a little more serious.
Okay, this next part is absolutely crucial to understand. There's a big difference between two things. Are you going frequently, but only a little bit comes out each time? That often points to a problem with the bladder itself, or the prostate. Or are you experiencing what's called polyuria, where you're actually producing a huge volume of urine? That suggests it's a bigger body-wide issue, maybe something metabolic or hormonal.
So if the problem is just frequency, here are the kinds of clues to look for. A burning feeling or that sudden, I gotta go right now urgency, that often spells UTI, a urinary tract infection. For men, especially over 50, if the stream is weak or you have to strain, that could be a sign of prostate issues. But it could also point to things like kidney stones, STIs, or, for women, certain gynecological conditions.
Now, if the issue is that high volume of urine we just talked about, diabetes is often a prime suspect. But, and this is key, there are 2 totally different kinds. You have diabetes mellitus, that's the common one, which is all about blood sugar. Basically, extra sugar in your blood pulls water out with it, making you pee a lot and feel thirsty and hungry. But then there's this much rarer thing called diabetes insipidus. It has nothing to do with blood sugar. It's a hormone problem that messes with how your body holds onto water, and it can lead to extreme urine output. We're talking sometimes over 8 liters a day. It's wild.
All right, let's zoom in on a really specific and, let's be honest, super frustrating problem. Waking up in the middle of the night just to go to the bathroom.
There's a medical term for this. It's called nocturia. And what's fascinating is that it's not always just about your bladder. It can be a clue about what's going on in your entire body.
So how does this even happen? This breakdown explains it perfectly. During the day, gravity is pulling fluid down into your legs, especially if you have circulation issues. Then at night, you lie down. Gravity's out of the picture. All that fluid that was hanging out in your legs gets reabsorbed back into your bloodstream. And what happens next? Well, your kidneys see all this extra fluid and they get to work filtering it out. That fills up your bladder and boom, you're awake.
And because of that whole fluid shift thing we just talked about, nocturia can actually be a warning sign for some pretty serious conditions that have nothing to do with your urinary tract. It can be linked to heart conditions like heart failure or high blood pressure. It can also point to kidney or liver disease. Even things you wouldn't expect like sleep apnea or acid reflux have been connected to having to get up at night to pee.
Okay, we've laid out all the evidence. We've examined the clues. Now it's time to close the case and turn all this information into a real, concrete action plan.
Now, this is incredibly important. These are the red flags. If you're dealing with frequent urination and you have any of these other symptoms, things like pain, seeing blood in your urine, running a fever, or losing weight without trying, it is absolutely essential that you go see a doctor. Please don't put it off.
But hey, for anyone who's struggling with those nighttime wake-up calls, here's a super practical tip you can try literally tonight. It's called the double voiding technique. Before you go to bed, sit down and empty your bladder like normal. Then, without getting up, just lean forward a bit, wait for about 30 seconds, and then gently try to go again. This little trick helps make sure your bladder is truly empty, and it might just help you sleep through the night.
At the end of the day, treatments can be anything from simple lifestyle tweaks to specific medications. But the number one thing to remember is this: the right treatment always starts with the right diagnosis from a healthcare professional.
So there you have it. We've decoded the warnings, you've seen the evidence. The most important part is what you do now. It all comes down to listening to your body, not just brushing these signs off as no big deal, and taking that first step. Having a conversation with a professional is how you're going to solve this mystery for good. So I'll leave you with this question. After everything we've talked about, what is your body telling you?